I now give the floor to the civil society organization Physicians for Human Rights.
Thank you to Denmark, New Zealand, and Spain, and to our colleagues who are here. Physicians for Human Rights works at the intersection of medicine and public health and human rights, documenting these attacks on healthcare over the years. We are heartened to hear of the commitment, multiple statements in support of UNSC Resolution 2286, but talk is cheap. The lack of accountability has been mentioned many, many times. We look to states to cooperate in accountability mechanisms, sign the Ljubljana Hague Convention, cooperate under universal jurisdiction mechanisms, support the ICC, at least don't sanction the ICC when it carries out these investigations, support the WHO instead of cutting it off, and support civil society. Talk is cheap, so is civil society. I want to mention two important facts reflecting our research. We've talked about the strengthening of international humanitarian law, but it's also crucial to understand that this is a matter of human rights law. This is a question of right to health. And PHR's research has shown that these attacks on healthcare are not just about the immediate attacks in the context of a conflict, but they aggravate a complex crisis, massive displacement, hunger, breakdowns in the healthcare system, and breakdown in the international system that was protecting this. The result is spikes in chronic and infectious diseases. Our research has shown rises in HIV, drug-resistant TB, Mpox, measles, and of course, chronic diseases. This is a mixed crisis of IHL, human rights law, and public health. And the UNSC is the only global forum that can host and advance the necessary multifaceted response. And finally, the important part of this is to note that IHL is not just about which facilities have become militarized and can be attacked. The other points of proportionality and precaution are crucial to this debate, and they are a danger of being forgotten. PHR's research has shown that when a healthcare clinic is damaged, it's not just about the possibility that it was used by militias. That's a crime. Let's prosecute it. But that means that pregnant women don't go to seek healthcare, diabetics don't go to seek healthcare, and the reverberating impacts down the years and horizontally must be taken into account. So we hope that this will be taken into account by militaries and as part of any accountability processes. We take the words that are being stated here at face value. We will come back next year, and we hope we'll see a drop in these numbers. Thank you.
Agradezco al representante.